Hey LinkedIn, and welcome back to Business Unusual, a live show where we're talking with you about how the coronavirus is impacting the ways that we all work. I'm your host, Caroline Fairchild. Today's show hits home for me, literally. I think we've heard a lot about the experiences of the coronavirus from big cities, say like New York City, where I am right now. But the reality is that the pandemic is impacting communities everywhere, particularly small communities. And my hometown of Sun Valley, Idaho, which roughly Sun Valley and the two neighboring towns have 22,000 people in their population, has one of the highest infection rates of the COVID-19 crisis right now. And this is where I grew up. You see this article from the New Yorker right now, why an Idaho ski town has one of the highest COVID-19 infection rates in the nation. On today's show, I'm going to bring you a panelist of people who are from Sun Valley who will talk to you about what it's like on the ground right now for them dealing with the virus in a very remote rural area. But before we hear from them, I want to hear from you. The whole point of this show is to have a conversation about how the coronavirus is impacting all of us. I don't know where you are in the country right now, where you are in the world, but your experience is valid. I want to hear about it. Drop what's going on in your world into the stream, and let's have a conversation about that together on today's show. Okay, Sun Valley, Idaho. Most of you probably have never been to Idaho. Most of you probably never even heard of Sun Valley. So I want to share with you a little bit about what the town is like and what it's like to live there, because it's such a rural, unique experience. You'll see this is Sun Valley right now. It's a beautiful place. It's a ski town, so there's a lot. The economy is run by tourism right now, and this place it's really small. This is the local grocery store where we all get our groceries in the middle of town. This is Main Street. It takes about 2 minutes to drive down the entire thing. And this is where I grew up. This is a picture of me when I was 4 years old on the playground with my best friend, Emily. Here I am with my mom. And I'm showing you these pictures because it kind of illustrates how different of an experience it is to grow up in Sun Valley. How is it different? Well, you go to the grocery store and you know everybody. You know everyone who's in line with you. You know your community members. You not only know your neighbors, but you're likely in book clubs with them and you're doing social things with them on the weekend as well. This will surprise a lot of people on the stream, but when you drive into town and you drive into Sun Valley or to Ketchum, most people don't lock their cars. That's how small and tight-knit the community is. So what that means amid a global pandemic is that everyone in Sun Valley right now, the thousands of people, everyone knows someone who's been hit by the pandemic. And I think that really speaks to how the community is coming together in this time of need. And I think there are a lot of lessons that we can all learn from that experience. I also want to hit on how the small rural nature of Sun Valley impacts the medical community there. The local hospital, St. Luke's, they have 1 ventilator and 2 ICU beds in the entire hospital. I'm sure you've all seen headlines about cities that need thousands of ventilators right now in order to support their communities. This hospital in Sun Valley just has 1. And so what that means is that many patients, the most critical of patients, I should also mention that Sun Valley has a population that is older than, say, the average population here in New York. The most critical patients are having to be life-flighted to neighboring cities to get the care that they need. We have a map that we're going to show you to kind of give you some geographical distancing about what exactly it is like in Idaho and how far the hospitals are from each other. So if you look at St. Luke's, which is the local hospital, 1 ventilator, 2 ICU beds that I mentioned, the hospitals where they're life-flighting people to, they're 2.5 hours, 1.5 hours away. The people that are getting life-flighted, of course, are not driving. But I just wanted to share this because these are the closest hospitals. And so can imagine being in such a remote rural area where there is such a high rate of infection. The medical community is really having to respond. We're going to speak with someone today who had had COVID and now is repairing from that, and talking about that medical experience, and also talking to some small business owners as well as some nonprofit leaders who are supporting the community during this time. I want to get to the community aspect of Sun Valley. And so I put a call out onto LinkedIn to have people from small towns everywhere tell us what it's really like for them on the ground. And I heard from many residents in Sun Valley. We're going to pull up a share here from Ellie Newman, who this really speaks to just how common the experience is in Sun Valley right now. She says, "We lost a beloved neighbor. I can see his house out of my window as I write. This town is like a marriage. We're in it together in sickness and in health, and we will both rise up." And so I just think that really speaks to how close-knit the community is and how they are dealing with this pandemic together. Another point that I wanted to make about Sun Valley before we hop on with our panel is that this is a tourist economy. I'm sure a lot of you have seen the stats around how the service industry is 75% of the US economy. Well, I would venture to guess that in Sun Valley, it's closer to 90%. As you can see, Jennifer Dahl writes, our local economy is primarily dependent on tourism and construction. That's all come to an abrupt halt. And so this is just something that I think is really critical to talk about, because it's a tourism destination and all of that is done. And so it has dramatic impact on the small business owners who are not getting the income that they thought they would need at this time. But the small town experience is not unique to Sun Valley, of course. I put a call out on LinkedIn, as I mentioned, to hear from people in other remote locations, to hear what's going on with them, some other hot spots. This is from a nurse that I reached out to in Bozeman, Montana, who says we have one hospital and the next hospital is 25 miles away. We're seeing a community that's coming together through business. They're making us washable masks with filters and washable gowns. Local restaurants have brought us food as a thank you. I just thought that that was so beautiful that the community is really coming together and supporting each other during this time of need. All right, I also want to see a comment from Central Oregon that stood out to me in this stream. This is from Sember Friend. She said, regardless, we still have the sense of community. I see a post every day on Facebook with resources, people asking to help others. And I called the local Pizza Hut and donated a few pizzas for school kids and seniors that caught fire. I just think we all need to hear these stories right now. The headlines are crazy. The pandemic is taking over the country, but seeing this community really come together, these small communities, is something that I really want to get to on the show today. I'm seeing a lot of members joining us from small towns on the stream. Connie is here with us from a small town in Louisiana. Jen from a small town in Michigan. Mark says hello from Sun Valley. Hi, Mark. Thanks for joining us. Wendy listening from Sun Valley to recruit for St. Luke's in Sun Valley. That's great. Thank you all for joining us. We want to have a conversation with you on today's show, so keep us posted on what is going on in your world. I think this is a great time to bring in my panel of Sun Valley locals to talk to us about their unique experiences dealing with COVID-19 on the ground in Idaho. Hi, Mary. Hi, Alan. Hi, Allison. And Duffy, welcome to the show.
Hello, thank you.
You're bringing Sun Valley to my home office here in New York. So first of all, I want to thank you for that. But I just want to hear how all of you are doing. Duffy, I want to hear from you. You contracted the virus and now are on the mend. Talk to us a little bit about how you're feeling today and how you think you got the virus to begin with.
Thank you. This is wonderful. My family has owned a restaurant in Sun Valley for 47 years. Ironically, I was working about 3.5 weeks ago, and our restaurant is a local restaurant that the locals come in, and at the same time, the visitors come in. And an 83-year-old lady came in, and I recognized her and I hugged her, only to find out 4 days later she was life flighted to Twin Falls because she tested. I think she was the fourth person in our county to test positive for the virus. I'm sure what happened was, by having close contact, I then contacted the virus and started to have the symptoms roughly about 7 to 10 days after I'd hugged this lady in the restaurant. Mm-hmm. Through the difficulty of breathing. And a small story is, as our town closed down, my doctor literally opened up his closed medical clinic to test me, to give me a physical, to tell me I had pre-pneumonia, and worked with me personally to take care of me. That's the kind of town.
Right.
The town is, and I apologize, but it's the people that make it up. We have an incredible, wonderful family community, and we watch out for everybody.
You certainly do watch out for each other. I want to see a quick show of hands. Wes, my producer, if you could bring up the whole panel. Does everyone know someone who either has contracted or has been tested for COVID right now, or know someone who's directly impacted? I was speaking with the team earlier today, and we were saying that experience is so unique. Alan, can you talk a little bit? You've been in Sun Valley for 35 years. Bring in some color of what the community is like and how it's been responding to the virus in real time.
Well, on a personal level, Sun Valley is my
private Idaho paradise. And I work all over the world. Every time I come home, I feel like I've come back to the great mother, the hearth of my community and of my environment. And I was in Calgary March 13th, found out that my son was being sent home from university. And I thought, I better get home too. Of course, within a few days, Canada and America shut their borders. And when I got back, I could really get the sense that it was beginning to grow here. And next thing I knew, my son had it. And so he went into quarantine within 2 or 3 days of my getting home. And it kind of raged through not only his health, but his friends and his friends' families. I don't think I got it, or if I had it, I had a very minor version of it. And thank God he's fine now. But as we've all been quarantined from each other, really, in this shelter at home, everybody's taking care of each other. We're reaching out constantly. What do you need? Bringing food to our neighbors. And I think now people are taking it seriously. The really big problem for me at the beginning was because we live in such an exquisitely beautiful place, and basically everyone here is so healthy. It took a long time, I think, for people to recognize that we really needed to take sheltering at home seriously.
Right.
And thank God that's now happened. We've been very, very careful.
Right. And we were just talking about this before the show started, but Allison, you mentioned that it's taking up to 12 days, even if you get tested at St. Luke's. And this is something that a lot of small towns, and the tests are getting faster, but 12 days is still a really long time to know. Should I go to Atkinson's and go to the grocery store? Should I be picking up food at the PIO? Allison, with your dad contracting the disease, how have you been coping with that? And how are you seeing community members respond in real time to the lack in the testing?
Well, I think that the lag in testing has been really frustrating for everyone, but there's an awareness of that. And due to that, we've all been really supportive of saying, stay home, don't go out, don't go to the grocery store, order the pickup. And then there's been a really unique way of people staying in touch. A lot of it's been through Facebook, of sharing, hey, these are some of the symptoms I had. These are the places that I went to. I went to this event, or I was over here the other day. And sort of with that lack of confirmation of tests, people trying to understand the potential for their own exposure and then do the right thing to make sure that we're protecting some of the community members that we know are vulnerable.
Mm-hmm. And speaking of the community members who are most vulnerable, I want to bring in Mary from the Hunger Coalition. Mary, talk to us a little bit. First of all, thanks for all the work that you're doing. Talk to us a little bit about the Hunger Coalition and why it is so crucial right now for the community in Blaine County.
Well, I just want to echo what you've all said. This is such an amazing community, and we are all really rallying together right now. In addition to that, this is the tourist economy and is made up of working class people. But at the end of the day, it seems like the deck is stacked against all of our working class people. Just a little background on that. Haley has the 8th highest grocery costs in the nation. Blaine County has the 9th greatest wealth inequality, and over the last 10 years, wages have actually dropped when adjusted for inflation. United Way reports that 38%, or 8,000 locals, are food insecure or one crisis away. And with the shutdown of non-essential services, the mountain closing 3 weeks ago, restaurants closing, this is that crisis that is pushing people over the edge, and they're struggling to put food on their tables.
And you told me yesterday some of the uptick in numbers that you're seeing at the Hunger Coalition amid the pandemic. Can you share a little bit to kind of let the audience know what the demand is right now in Sun Valley for these essential services and the food?
So during the first week that the COVID crisis hit Sun Valley, or the Wood River Valley, we saw double the numbers that we usually see in 1 week. And then last week would be our 3rd week, and we had 351 families access our food assistance, which represents about 900 individuals, which is the highest that we've ever served in 1 week.
Right. 900 individuals is a lot in Sun Valley. To give you guys some numbers, I said 22,000 in Blaine County, but Sun Valley and Ketchum, they're closer to about 5,000. So, I mean, these are huge numbers of people who are in need of they're out of work and they're in need of food. Duffy, I want to bring you in because obviously the Pioneer, I want to give a little bit more color on the Pioneer. This is right in the middle of Main Street. This is one of the places that you just have to visit when you come to Sun Valley. Think big pieces of meat, think huge baked potatoes, huge artichokes. This is a place where you have to go. They don't take reservations. You just have to put your name in, but people wait. I wait as a local. I'll wait for 2.5 hours, have a couple martinis. And this is one of the most vibrant places to be in Sun Valley. Obviously, your business is not running as usual. Tell us what you're doing, how you're trying to keep people employed, what services are like right now.
Well, thank you. Our business is down for the last 3 weeks, 95%. We laid off 50 employees, and they're really not employees, they're family. The majority, at least 50% of my employees, have been working here for over 20 years. And we're doing what we can to help them be able to pay their bills, and we're taking personal interest and communicating with them where we can help. The frustrating thing in a small community is we're trying to get masks for everybody to wear, but there's none in town, so we can't help them that way. But we're encouraging them to take care of themselves, take care of their families, let us know what we can do. And we are seeing incredible generosity. Again, I'll say, as beautiful as this town is, it's the people that make it up. And we are seeing donations come to us. We turn around with the donations and are supplying the Hunger Coalition, the hospital staff with free meals. And that indirectly comes from personal donations from people that want to help their neighbors out.
Right.
But our town is being devastated by the fact that we are a tourist town. The mayor, the governor has said, do not come to our town anymore. Everyone in town is basically self-quarantining. All businesses are closed. The town is a vibrant tourist town has really come to a shutdown.
Duffy, you said something that reminded me of a common phrase in Sun Valley, which is you come for the winters, but stay for the summers. And I think in this case, you come for the winters, you stay for the people. Alan, I know that you've been working on some mask efforts locally that Duffy was just talking about. Speak a little bit about what you were doing, the work you were doing in China, and how that shifted as the pandemic shifted.
So I had been in China in January. I came back on the 11th. I did go straight to New York, so nobody should think that I brought back here. And nobody around me got sick, so I think I had missed that bullet, so to speak. But when I returned, my colleagues in China were in desperate need of masks, so I started sending masks to China. And of course, didn't get any for myself. But then as this began to explode, I put the word out to as many friends as I could that we needed masks here, particularly our hospital. And at that point, our hospital was closed, which was a very scary, we went through a period of time where only the ER was open. And so that was very disconcerting as a resident here with everyone getting sick. My son was sick. So I thought getting masks would be really important. Friend through a friend connected us with the chairman of a Chinese investment company. And he donated 595 masks to the hospital and shipped them from the East Coast. They were here within 3 days. And the hospital in turn is going to be sending some of them to different organizations in the Valley that are in desperate need of masks as well, like the Advocates of the Hunger Coalition. So I thought it was amazingly poetic that I had been sending masks to China, and then this gentleman very generously donated 500 of the most valuable masks that we could have for our hospital.
Right. And I think that really speaks to something that in hosting this show I've picked up on, which is we're all alone, but we're all going through this together. I'm seeing some comments in the stream right now that I want to get to. Julie says, I live in Meridian, Idaho, and work at St. Alsiph Napa, about 20 minutes from Boise. I'm an ICU nurse working with COVID-19 patients, being life flighted to our hospital from small Eastern Oregon towns as well. Julie, thank you so much for joining us and for the work that you're doing on the front lines. Daniel says, I work at a small local radio station in Wimberley, Texas. We only just got our first active case registered 2 days ago. We're keeping ourselves, our community population is primarily older, which is something that the Sun Valley community is experiencing as well. So we're working to keep our population sheltered in place. I'm seeing some comments in the stream too about people saying that they don't know anyone who has COVID-19, even though you are in some of these hotspot areas. But I just wanted to mention that just because you're not showing symptoms does not mean that you do not have the virus. So I know our medical professionals would still appreciate it if you do shelter in place at this moment. Allison, I want to bring you back in. You are a therapist. You work a lot with mental health. How are you staying sane? How is the community staying sane? I know I'm having a really hard time. What are you advising your patients right now? And kind of how are you keeping your family together?
Well, thank you for asking. I think right now the importance of mental health has really been highlighted. We're lucky here in the Wood River Valley. We have a very active NAMI chapter, which is the National Alliance for Mental Illness. And we've been able to continue doing a number of support groups, even though we've moved those support groups to Zoom. And we're now providing all sorts of other things that people can do in their living room, resiliency-based yoga training, and connecting people with resources, and of course handling a lot of the anxiety that people generally are seeing spike. And I think that our community is really wanting to lean into each other in new and unique ways. I think, Caroline, you mentioned, we go to the grocery store and we see each other. We go to the post office and we can't wait to see our neighbors. We walk down the street or the bike path. And a lot of those opportunities to connect have been taken away from us. Yeah. There's a really amazing and beautiful thing happening at 8 o'clock every night. And people from up and down the valley come out into their yards and they start howling. And you can hear the echoing of howling from
I'm so glad that you brought that up, Allison. We actually have a video that I wanted to play because the howling is so unique and it is so Idaho. Here in New York at 7 p.m., we're having people clap outside their windows and it is beautiful, but I don't think it's as beautiful as this. I'm going to be quiet for a second so everyone can hear. So those are people howling. If you're on the stream right now, those are not wolves. There are wolves in Sun Valley, but not that many. And I just think that really speaks to just how the community is coming together right now. It's such a beautiful thing. Mary, talk to us a little bit about what locals are saying their biggest challenges right now that are coming to the Hunger Coalition looking for essential services.
A lot of people are even unable to travel to the Hunger Coalition. Maybe they're seniors and they have contracted COVID or are sick or are told to isolate. So we're actually bringing food to them. We ran out of toilet paper too at our grocery store. So people are struggling to find that, but we're just food, so we don't supply that. And I really think it's just people really not being able to afford the food. We also have been calling seniors who we know are more isolated and checking up on them. We had people saying that they are glad that we're calling them in case they died so that someone would know. And I think that might be a large struggle right now is the older population who don't necessarily have any contacts or family in the area, and they're isolated and have no way to get food or talk to anybody. So that is something that we've been really trying to help with.
Mm-hmm. I mean, Alan, anything to add there in terms of what you're seeing on the community home front of ways to support the elderly population right now, particularly given that everyone is so distant, maybe they don't have very many neighbors, and maybe feeling socially isolated right now?
Well, I think all of us are reaching out to the elderly neighbors that we know around us. I have a cute story I'll share quickly, which is that I have a 90-year-old neighbor, and I went and put a note on his door that if he needed me to get groceries or help him in any way, I would love to. So he called me the next morning and said, "Thank you so much for that thoughtfulness, but really I want to help you." And I said, "Well, no, let me help you. You stay home." And he said, "Well, listen, if you have any heavy furniture you want to move, I'm here to come help you." And it was so sweet because he wanted to help me more than he wanted to accept my help, which is, you know, back to what Allison said, we're all reaching out to each other. And I'm not alone in reaching out to our elderly population here. And people are taking food to each other and making sure they're okay.
I think that's so beautiful. I want to, before I let you all go, I want to give you guys all an opportunity. There are people from all across the world on this stream right now, and they are talking to us Idahoans. A lot of people haven't even met anyone from Idaho. What would you want them to know? You guys are you are at the peak. You know, as I said at the beginning of the show, Sun Valley has one of the highest incident rates of COVID-19 right now. What do you want the world to know about Sun Valley, about your community, and any lessons about going through this right now? Duffy, no pressure, but I'll start with you.
Well, I truly believe in the golden rule. And I also believe it's better to give than receive. And our community is a giving community. It's not about me, it's about what I can do for my family of employees, and my neighbors.
It's great sentiment. Anything to add there? Maybe Mary, go to you.
I just wanted to thank Allison and Duffy and Alan, you know, just as, you know, fellow community members for coming together and supporting one another. Also, just in general for food assistance organizations, anyone who's listening out there, it's better to donate money so that the food organization can effectively respond the best way. They can get cheaper food through wholesale purchasing than it would be if you donated actual food. So if you want to help people, donate some money, and the food organization will be able to help more people and stretch your dollar and have it go further.
Great tip right there. Alan?
Yeah, you know, globally, this is a very scary time. All of us are having to face a fear of mortality, and the idea that we can infect each other is terrifying. But what I've seen here we are at one of the hotbeds, and our resiliency is so inspiring. And we'll all get through this. I feel like we're a good model for the fact that, you know, I probably know 50 people that have become ill with this virus. And we're making it through. And we pray for those that I hear flying overhead and the helicopters going from the hospital here to other hospitals. But we will make it through this. And I thank my other 3 colleagues on here, because I feel like hearing their voices makes me feel very proud to live where I live.
Yeah, a lot of Idaho pride for sure. Allison?
Well, I'll echo what Alan said, and I think we are a very resilient community, and you know, pulling together, and when it's tough, and helping out, and what we're doing in terms of just trying to provide our service and food to people who can't have it. I think it is just, it's very much what we do. And for those of you who have not yet had the opportunity to come and visit us, I would say come and see Sun Valley, not just for our beauty and our recreation, but for the people who live here. We are so blessed to be surrounded by amazing people with such big hearts.
And I see a lot of that amazing small town experience in the stream right now with our global community. Liz says, watching from Ohio, we have some great small towns, hoping our communities can pull through this all. Carla says, hi from Placerville, California, between Sacramento and Lake Tahoe. Donna joins us from a small parish in Louisiana. Hi, Donna, thanks so much for joining us. And June says, thank you all very much for participating in this live chat. Small mountain towns are the best. Writing from Waitsfield, Vermont, the Mad River Valley. June, thank you so much for joining us. And I want to thank Mary, Allen, Allison, and Duffy. It is great to see a slice of home here in my home office here in New York City. I am thinking about all of you. Thank you for all the work that you're doing, and I will definitely see you soon.
Thank you.
Thank you.
Bye. Take good care. Be safe, everybody.
All right, well, that was our panel of Sun Valley, Idaho locals. As we talked about at the top of the show, Sun Valley has one of the highest incident rates of COVID-19, and I wanted to spend some time with you all today to talk about that small town experience and how it's different, but also bring to you some of the smaller communities and what you can learn from them during this time. I want to thank everyone for joining me on the show, Mary, Alan, Allison, and Duffy. I want to thank everyone here on the stream, seeing lots of community members supporting each other, Julie commenting that she's a registered nurse, and then Connie saying thank you. This is the community that we want to bring together every day on this show. Tomorrow, my colleague Susie Jackson will be with you zooming out a little bit, talking about hiring overall and what that means for people who have the many, many millions of people who have lost their jobs. Another important critical topic during this time. I'm Caroline Fairchild. This is Business Unusual. Thank you so much for joining us.